If you receive Social Security benefits and also are enrolled in Medicare, 2026 may bring one of the most consequential knocks on your monthly income that you've seen in a while. A significant increase in Medicare Part B premiums for 2026 means that although your Social Security check will go up via the cost of living adjustment, COLA, much of that raise may be swallowed by higher healthcare costs. In this video, we'll walk through what the 2026 Medicare Part B and related premium changes look like, how those increases will affect your Social Security check net, what the official COLA for Social Security is and how much you'll actually receive, what you should do now to prepare and protect your finances. The Social Security COLA for 2026. Let's begin with your benefit increase. The Social Security Administration has announced that the cost of living adjustment, COLA, for 2026 will be 2.8%. KFF. +1. Bullet points. A raise of 2.8% means on an average benefit of roughly $2,000 per month, you'd see about $56 more each month. Barons. +1. Married couples receiving two benefits will see more, but the same percentage increase applies. Kiplinger. The COLA is designed to help the benefit keep pace with inflation, but it doesn't guarantee your take-home increases by that full amount. The Medicare Part B premium spike. Here's where the trouble begins. Medicare Part B premiums, which for many beneficiaries are automatically deducted from their Social Security checks, are rising significantly in 2026. CMS. +2. KFF. +2. Bullet points. The standard monthly Part B premium for 2026 is set at $202.90, up from $185 in 2025, an increase of about $17.90 per month. CMS. +1. The annual deductible for Part B is projected to rise to $283 from $257. CMS. For those with higher incomes, the so-called IRMAA, income-related monthly adjustment amount, surcharges will also increase, potentially adding hundreds more per month. Given that the Part B premium increase essentially eats up much of the Social Security COLA raise, many beneficiaries will see very little increase, or none at all after deductions. KFF. How your check is impacted, the net effect. Although a 2.8% increase sounds good, the real question is, how much of that raise will you actually see in your bank account once healthcare deductions hit? Paragraph. If your Social Security benefit increases by $56 per month due to the 2.8% COLA, but your Medicare Part B premium increases by $17.90 per month, or more depending on income level, your effective increase drops to about $38 or less, before other possible deductions like higher Medicare Advantage premiums or supplemental insurance kicks in. For some beneficiaries, the premium increase might very nearly wipe out their raise entirely. Bullet points. Gross raise, almost equal to $56 per month, average. Less Part B premium increase, almost equal to $17.90 per month. Net raise, almost equal to $38 per month, for average beneficiary. For higher-income Medicare enrollees, net benefit may be near $0 or even negative if surcharges apply. If you're working and receiving Social Security early or under full retirement age, earnings thresholds and other deductions may further reduce your raise. Why these premium hikes are happening? Understanding why helps you plan. Here are the key drivers behind the Medicare cost increase. Bullet points. Healthcare costs continue rising. Equipment, outpatient services, drugs, and Medicare must adjust accordingly. Medical news today. +1. Usage of Part B services and medical inflation are higher than the general inflation rate on which COLA is based. Mercer advisors. The Medicare Trustees Report and CMS have flagged significant increases in cost burdens on the system, resulting in larger premium increases. Investopedia. Low interest rates, deferrals, and other budgetary pressures mean Medicare compensates with higher beneficiary payments. Who's affected the most? While virtually all Medicare enrollees will feel this, some will be hit harder than others. Bullet points. Standard beneficiaries, income below IRMAA thresholds, will face the base increase, reducing their net raise. Higher income enrollees will face IRMAA surcharges in addition to the base premium, potentially reducing or eliminating any net increase. The finance buff. +1. Working retirees or those under full retirement age who receive benefits and are still earning may see compounded effects due to earnings limits. Beneficiaries who rely heavily on Medicare Advantage, Part D drug plans, or other supplemental insurance may see additional premium or cost increases, worsening the net effect. What you can do right now to prepare. You're not powerless here, there are proactive steps you can take. Bullet points: review your Medicare enrollment and check your plan premiums and benefits for 2026. Compare alternatives during the open enrollment period, October 15th to December 7th. MedicareGuide.com. Estimate your Social Security net benefit for 2026 by taking your current benefit times 1.028 for 2.8% raise, then subtract the expected increased Medicare premium. Verify your Medicare premium deduction from your Social Security check in upcoming statements and plan accordingly. Budget accordingly, plan for less extra income than expected and prioritize essentials, healthcare, housing, etc. White heavy check mark. If your income is near a threshold for IRMAA surcharges, consider tax strategies, if applicable, to minimize extra premium surcharges. Kiplinger. Myths and mistakes to avoid. Avoiding misconceptions helps you stay in control. Bullet points. Myth: my Social Security raise will equal the COLA. No, healthcare premium increases will reduce the raise. Mistake: ignoring IRMAA thresholds. If income increases slightly, surcharges may jump. Mistake: assuming Medicare Advantage or supplemental policies are unaffected, they may also have cost increases. Myth: I don't need to act. While you don't need to apply for your COLA, reviewing coverage options and budgeting now matters. Bigger picture: why this matters for retirement planning. These changes aren't just about 1 year, they reflect deeper trends. Paragraph: when healthcare costs rise faster than general inflation, beneficiaries face greater financial pressure. The combination of modest COLA increases and rising premiums means many retirees need to revise their budgeting, savings, and expectations. These cost shifts underscore the importance of diversifying income sources, minimizing debt, and planning proactively rather than relying solely on benefits that may fall short of cost inflation. Bullet points: cost of living adjustments may lag actual inflation in healthcare and housing. Your take-home benefit is increasingly sensitive to premium and deductible increases. Retirement savings, part-time income, and cost management are more critical than ever. Knowing the rules and timing gives you a head start versus being caught by surprise. What to watch for in late 2025, early 2026. Here are upcoming milestones and signals to monitor. Bullet points: late 2025, SSA will send you a notice of adjustment showing your 2026 benefit and deductibles premiums. AERP. The official Medicare Part B premium for 2026 will be announced by CMS. Confirm actual amount and compare with projections. CMS. +1. Review your Medicare Advantage and Part D plan notices for changes effective January 1, 2026. Monitor January checks to see actual net effect, how much landed versus expectations. Watch for any legislative or administrative changes that may adjust premiums, surcharges, or benefits mid-year. In summary, yes, Social Security checks will go up in 2026 thanks to a 2.8% COLA. But for many beneficiaries, particularly those enrolled in Medicare, the increase may feel far smaller once the higher Medicare premiums hit. The premium increase is significant and reduces the net benefit you take home. That means this year your focus should be on planning, reviewing your coverage and budgeting for less of a raise than you may have hoped. White right pointing back hand index. If you found this video helpful, please like, share, and subscribe so you and your friends stay informed. Thanks for watching, stay alert, stay prepared, and take control of your benefit story.